Dear audience, let me introduce my PhD topic, which is the role of alternative treatment methods in lung cancer. My name is Shahar Adar. I'm first-year PhD student and fifth-year medical student. My supervisor is Danny Shorvathi, and my SMS is Nina Galditska. My vision is to increase the quality of life and the survival rates of patients with lung cancer, and my mission is to conduct a comprehensive analysis of different treatment methods of lung cancer. In my speech, I will mention two projects. Both of them are associated with different definitive treatment methods for patients with early-stage non-small cell lung cancer. My first project, investigating the safety and the efficacy of local regional therapies in early-stage non-small cell lung cancer. And I will choose the methodology of systemic review and meta-analysis to investigate this project. So a bit of a background. Every year there are 2.2 million new cases of patients which are diagnosed with lung cancer. Out of them, there are 85% which have non-small cell lung cancer. There are three main approaches for the definitive treatment of the disease. We have surgery, radiation therapy, and ablation therapy. Nowadays, surgery is the gold standard. And for those patients who are unable to undergo surgery, we have radiation therapy and ablation therapy, which are offered. Those are less invasive techniques or minimally invasive and are so-called the second line. There are a few disadvantages with surgery being a gold standard. So first of all, the longer hospitalization time and the rehabilitation time of patients undergoing surgery is way higher comparing to patients undergoing those minimally invasive techniques. For example, patients undergo surgery can be in the hospital for something like a week, maybe 10 days, whereas patients undergo radiation therapy or ablation therapy will be in the hospital for 24 hours observation. Additionally, study shows that up to 24% of the patients that needs to undergo surgery refuse to do so out of fear of complications and other personal reasons. That is the reason we would like to investigate whether ablation therapy or radiation therapy are as effective and as safe as surgical resection, not only for those people who are unable to undergo surgery, but for all patients with early-stage non-small cell lung cancer. Our clinical question: can lung ablation or radiotherapy serve as a viable alternative to surgical resection for the treatment of early-stage non-small cell lung cancer? And we hypothesize that ablation and radiation are non-inferior to surgery. By investigating this topic, we will actually translate this medical knowledge into a better patient's treatment. So we will personalize the treatment for the patient. The patient will get the best treatment that they can have. During our project, we started by finding those key articles. As you can see, there are two colors. The upper part are articles which compare surgery and radiotherapy, surgery as the gold standard and radiotherapy as a less invasive technique. Whereas the lower parts, we can see articles that compare surgery as a gold standard with ablation therapy. There are very few articles which compare all three arms of this treatment. We conducted this search key. It has three domains. The first one is our population. The second one is about the surgical resection, our surgical resection. And the third one is the less invasive technique, so either radiation therapy or ablation therapy. We conducted this search key with three databases, and we found around 9,000 articles that are associated with this topic. After duplicate removal, we found that there are around 6,800 articles, and with my co-investigator, we are in the process of title and abstract removal. We submitted the project on Prospero, and we are on the working phase of the title abstract removal. My second project is investigating the safety and efficacy of lung cryoablation and surgical resection for the early treatment of non-small cell lung cancer. And we will choose the methodology of randomized controlled trial to investigate this topic. So as I was saying, surgery is now the gold standard for the definitive treatment of the disease. However, there are a few disadvantages with surgery. We said that there is a longer hospitalization time and longer rehabilitation time. That is why the less invasive or the minimally invasive technique started to get more and more prominence in the medical area. Around 20 years ago, there was a new technique, the ablation technique, which I mentioned before, which started to develop. And specifically, I'm going to mention about the lung cryoablation. There are no randomized controlled trials so far that was published comparing ablation technique and surgery for the definitive treatment. So, about lung cryoablation. With the aid of CT image, the patients, or the physician, insert probe to the patient chest. Those probes will reach a very cold temperature of around -60 degrees. The cold temperature will result in shrinkage and destroy of the tumor cell. All the enzymatic activity will be destroyed. And we will form the so-called the ice ball, which is a really ball made of ice. After that, the physician will increase the temperature of the rod, of the probes. By doing so, it will form a hypotonic solution or hypotonic environment, and water will get inside the cell and will destroy or result in explosion of the viable remaining cell. By that, we could actually destroy the tumor. On picture A, you can see a tumor in the lung, and in picture B, you can see the cryoprobe with the ice ball itself. And this is the ice ball, which is circled by red. Now, we aim to investigate whether this lung cryoablation is as effective and efficient as surgical resection for the definitive treatment. Our clinical question: can lung cryoablation provide a viable alternative to surgical resection for the treatment of early-stage non-small cell lung cancer? And our hypothesis is that cryoablation is non-inferior to surgical resection. And again, by investigating this topic, we could actually provide a better treatment personalization for the patient. The patient will get the best treatment that they can have. I would like to summarize my projects. So in the first project, we had investigating or comparing all the local regional therapies: surgery, radiation, and ablation. And in the second project, we are specifically focusing on lung cryoablation and surgical resection. I would like to finish my presentation with a quote of Patch Adams: "You treat a disease, you win, you lose. You treat a person, I guarantee you'll win, no matter what the outcomes." Thank you very much.
Thank you very much for the great presentation. So now, question part, please. Left side.
Hi, Shahar. Great presentation. You mentioned that there are several ablation techniques. Is there a specific reason why you picked cryoablation over the other ablation techniques?
Thank you very much for your question. If I go back for a second, you can see on picture B that when we use the cryoablation, by forming this ice ball, the physician can actually see during the procedure the ablation zone, which is actually the death zone of the tumor. By that, the physician can see on the spot where the tumor is, and he can make sure that all the ablation encircle all the tumor edges. So in other ablation techniques, the radiofrequency ablation or microwave ablation, the ablation zone is also seen, but it takes a few days. However, in cryoablation, it's on the spot, so during the process itself. That is the reason we chose cryoablation technique.
Thank you for your presentation. My question is whether you are planning to pull together video-assisted surgery patients and open surgery patients, because the outcomes can be very different in these populations.
Can you repeat again, please?
So in surgery, you can perform it by video-assisted method and open method as well, but the outcomes can be very different in these populations. Are you planning to put together these patients or not?
Thank you very much for your question. Yes, we have also, as part of the surgery, also a minimally invasive technique, so the VATS, the video-assisted thoracoscopic surgery, in which it is less invasive. However, for our purposes, we are mentioning as surgery as being surgery, either open or close. We can, however, do a stratification of the groups, but we will take consideration also the patients who undergo the less invasive surgical procedure versus the less invasive ablation or radiation. So we will take them under consideration.
So thank you for your lovely presentation. I just want to ask that, can you tell me something about the disadvantages of cryoablation?
Yes, thank you very much for your question. Well, cryoablation, as it is very good and less invasive, it contains some disadvantages. So first of all, the effectiveness of ablation technique in general decreases as the tumor becomes, or as the tumor is more central and deep in the patient chest. So we know that ablation techniques are more effective in peripheral tumor rather than central tumor. This is one thing. In addition, we have the risk of pneumothorax, bleeding, infection, which are related with cryoablation and other ablation technique. But those are the major disadvantages.
Thank you for the nice presentation. About your first project is about the early detection of lung cancer or early stage lung cancer. So what is the clinical implication? What would be the percentage of early diagnosis of this cancer type?
So you mean that out of those patients who are diagnosed with early?
Yes, yes, because your impact would depend on this.
Yes, that is true. I read an article about the percentage of patients which diagnosed with an early stage comparing to those with an advanced stage. And if I remember correctly, it's about 20%. 20% of the patients are diagnosed with early stage. The rest, unfortunately, are diagnosed with more advanced and inoperable phases.